Hi, I'm Karuna. I'm one of the digital community leads and remote GPs working for Babylon. One thing I love about working for Babylon is even though you have all the perks and flexibility of working remotely, I still feel part of an amazing, like minded community. I'm one of four community leads, and as a GP, on starting the role, you'll be allocated to one of our teams. So you have a really great support system from day one. We use an amazing instant messaging service, so during your shift, you'll be able to really easily connect and chat to your colleagues, asking them any questions or queries you might have during a shift. Another advantage is not only can you connect with other GPs, but you can also chat to our pharmacists, our physiotherapists, our nurses, our admin team, and our senior medical team. We hold a Zoom coffee room every single day, so you can pop in, have a chat, and catch up with everyone else, seeing what they've been up to. Despite working remotely, I really do feel part of a great team and really value the connections and friendships that I've made.
Hello, my name is Matt Noble. I'm Medical Director for Babylon's clinical operation here in the UK. I joined Babylon about 7 years ago now. At that time in the UK, at least, there wasn't really such a thing as what we now call a digital consultation. But over the past few years, we've seen a rapid increase in mobile phone technology around the world, and we at Babylon have been at the forefront of setting the standard for what we now call a digital consultation. Babylon's mission is to provide affordable healthcare to everyone on the planet. We do this by providing access to healthcare and sick care through our app, through our AI products, and then connecting people quickly and easily to a clinician when they need one. To give you some idea of numbers, in the UK, we now have around 350 doctors plus many other clinicians providing around 20,000 digital appointments per week. We run a private service and also our NHS service, Babylon GP at Hand, which provides full GP services for just under 100,000 patients now in London and Birmingham, including in-person appointments when needed. And that's just in the UK. We also have operations in Rwanda, Canada, and the US doing similar. But we aren't and never will be a faceless global company. Each and every patient interaction matters, and we're never going to lose that focus on the individual. So, what makes a good digital clinician? I'm asked this one a lot. My answer is always the same. First, they have to be a good clinician, be that a doctor, a nurse practitioner, a pharmacist, a physio, whatever. Someone who's clinically excellent and experienced in their field, but they also have to be great at taking a history, picking up on cues, adapting their consultation style to suit the digital medium. It's said, isn't it, that around 80% of diagnoses are made from their history, and that is particularly true when we're working remotely. There is never a substitute for a thorough, detailed history. There's no shortcuts. Of course, you also need to be good at carrying out examinations remotely where appropriate, but that part we find can be taught quite easily. So when I'm looking for a clinician, I'm looking for someone who's clinically excellent, who understands and can demonstrate the skill of taking a good history, but who also has the ability, the adaptability, and if you like, the humility to learn new examination skills that are needed for a great remote consultation. We select our team for these characteristics in the UK and around the world, and I'm proud to say that we have a great group of clinicians working for us. If you enjoy a challenge, if you love delivering accessible care, have a relentless focus on doing the best for each and every patient that you see, and you love being part of an exciting growing team, then I hope you'll love working for us.
Hi, my name's Nadia. I'm one of the GPs working for Babylon. I'm actually speaking to you today from our clinic site at Canary Wharf. So just a little bit of background about me. As I said already, I'm a GP. I was actually kind of initially working at a practice, doing 10 sessions a week and just coming very close to burnout. We'd started doing some telephone triage, and that's kind of developed the platform for me wanting to move more into digital consulting. I saw the advert for Babylon and I just thought, it sounds absolutely fantastic. So I started working for Babylon. Initially, I was working doing digital consulting and also in the physical clinics. And it was through starting working in the physical clinics that I really kind of felt I wanted to get more involved. I've been here for 3.5 years now, so I've obviously had an amazing opportunity to see how the clinics develop. And then started working in the senior medical team, and through there was able to take on a clinic lead role. And more recently have been appointed as the regional clinics lead for the London clinics. Working in the clinics is an absolutely fantastic opportunity. We've got a wide range of clinics available over London at a various number of sites, including at Canary Wharf, King's Cross, Fulham, Rains Park, and South Westminster. I work at the South Westminster one at the moment. And the clinics are absolutely a fantastic place to work in. We've got a huge range of staff working in there, from GPs to advanced nurse practitioners to nurses, phlebotomists, healthcare assistants, physiotherapists, and of course our incredible front of house. We've been in a really privileged position over the last kind of year and a half where we've actually kept our doors open for seeing patients. We've continued to see patients face to face throughout the pandemic, all through thanks to our wonderful staff who've been working on the front line. I think everybody can agree when we say that there's the most wonderful camaraderie in all the clinics.
My name's Tajal. I'm one of the Associate Medical Directors in the UK team at Babylon. I'm going to tell you a little bit about my journey with Babylon and where I started and where I've got to now. Back in 2018, I was looking for new opportunities and hoping to develop new skills. At the time, I was working 8 sessions a week in a local GP practice, and a friend of mine had said, why don't you try digital consulting, and you potentially could work from home. So it sounded great, and I explored all the options available to me at that time. Babylon was one of the names that sort of came to my mind, and it's something that I'd read about and heard of. So I applied and started work doing 8 hours a week from home. Working with a mix of NHS and private patients was really great. I was able to bring in the skills that I was using day to day in my salaried role, and I was able to do it at home and have flexibility in my role. Now, since then, it's been a bit of a journey. And later in that year, I moved to work for the team full time and spent more time focusing on clinical improvement and effectiveness, doing recruitment work and governance work. All the staff, and it's a really big team that works really well together. Both clinical and non-clinical staff are aligned in the mission of the organisation. They all want to work to improve the health of our patients and to make the service as best as it can. Since the last year, I've been working as an Associate Medical Director, focusing on clinical quality, and I'm also still supporting the GP workforce, helping with recruitment, education and training, and wellbeing. Reflecting on the last year, there have been many challenges faced by healthcare organisations across the globe and in primary care. It's been great working with the team here at Babylon, and we've faced these challenges together and managed to work so well through some difficult times. We've got over 300 clinicians working with us now, and what I love is it's so multidisciplinary. Every day I get to work with AMPs, prescribing pharmacists, physiotherapists, and mental health practitioners, and there's so much I can learn from them, and it's a real joy to work with them. One thing I've learned in this journey is that even with such a big team spread out across the country, all our clinicians are exceptional. They're dedicated, they're hardworking, they're thoughtful, and they're compassionate. And I'm incredibly proud to be part of this team.